Good afternoon. Thank you very much for joining us again today. I'll start, as usual, with an update on the COVID-19 statistics for the whole of Scotland. I can report that an additional 67 positive cases were confirmed yesterday. That represents 1.2% of the people who were newly tested yesterday, and it takes the total number of cases in Scotland now to 18,847. Just at one point of detail, today's 67 cases represents actually a net increase of just 66 because one of yesterday's cases has since been denotified. A full health board breakdown of today's cases will be available later as usual, but I can give you the provisional information that I have. Based on that information, 39 of the 67 cases are in the Grampian Health Board area. It's not yet totally clear how many are connected to the ongoing outbreak in Aberdeen, and I'm going to say a bit more about that outbreak shortly. I can also advise that, based on the provisional information, a further 17 of today's cases are in the Greater Glasgow and Clyde Health Board area, and we are examining these very carefully to see whether there are any patterns or anything about these cases. There was a relatively large number in Glasgow yesterday that caused us any cause for concern. A total of 270 patients are currently in hospital with confirmed COVID, and that's an increase of 3 since yesterday. A total of 4 people last night were in intensive care with confirmed COVID, and that's an increase of 1 since yesterday. I am glad to say that yet again, during the past 24 hours, though, no deaths were registered of a patient confirmed through a test in the past 28 days as having the virus, and the total number of deaths under this measurement therefore remains 2,491. Obviously, the total number of deaths, and remember the figures reported yesterday by National Records of Scotland show the figure being higher than that. The total number is still a reminder of the dreadful impact of this virus, and I want again to extend my condolences to everyone who is grieving a loved one. We will also today publish updated information about the prevalence of the virus in Scotland. Our modelling suggests that the R number, which you will recall is the average number of people infected by one other infectious person, is between 0.6 and 1. That is a slight increase on the last estimate, which was between 0.6 and 0.9. However, and this is an important caveat, and you'll have heard me say this before at these briefings, the R number becomes a less reliable indicator when the prevalence of the virus is as low overall as it currently is in Scotland. Our modelling also shows that the number of people in Scotland overall with the virus has continued to fall. Our central estimate for last week is that 275 people across Scotland were infectious, and these figures show again the sustained and substantial progress that we have made over the past few months, and I want to thank everybody who has contributed to that, and in particular to thank our health and care workers for everything that they have done and continue to do. But I do want, as I have been doing for the past few days, warn and very strongly warn against any shred of complacency. We have undoubtedly seen in recent days an increase in positive cases, and that increase might not yet be reflected in the modelling that I've just reported to you. And many of the cases that we've seen in recent days are of course linked to outbreaks such as the one in Aberdeen and the one in Inverclyde last week. But it's important to say that not all of these new cases are linked to outbreaks. So we really must be on our guard and recognise what these figures are telling us, which is that this virus is very much still out there and circulating in Scotland. Let me, though, provide the latest information I have on the situation in Aberdeen, and you will appreciate this is an active outbreak that is currently being managed, so this information will be changing regularly at the moment. But I can confirm that as of now, or as of me leaving my office a few moments ago, a total of 79 cases have been confirmed as associated with that cluster. That is an increase of 25 on the position I reported yesterday. There's a further 30 cases that are currently under investigation as possibly linked to the outbreak, and a total of 233 close contacts have already been identified, although of course as case numbers rise, the number of contacts being traced will also rise, and I would expect that figure to rise further during the course of today. As I said yesterday, many of those positive cases and contacts have been linked to a number of licensed premises in Aberdeen, and a list of those places is now available on the Scottish Government's website. And I think it's important to be clear here. What we mean is not that one particular person in this cluster has visited all of these premises. It is that someone who has tested positive has been in each location, but it will be different people in each of these locations. We've been asked why members of the public who have visited these premises have not all been actively contact traced, and it's a reasonable question. But the answer is that they may not have been there at the same time as the person who tested positive, or they might not be classified as a close contact. For example, they might not have been within the 2 metres for the requisite period. And the point of assurance I want to give you today is that contact tracers are professionals. They are highly trained experts in what they do, and they assess who should be traced. However, if you have been to any of these premises, even if Test and Protect hasn't been in touch with you, we're still asking you to be extra vigilant for symptoms, and if you have any symptoms, to put yourself forward for testing and self-isolate immediately. And although we're asking everybody in every part of the country to follow the facts advice, if you've been in any of these premises, just be that bit extra rigorous in everything you do right now. And if you are contacted by Test and Protect in Aberdeen, please comply with the advice they give you. In fact, if you are contacted by Test and Protect anywhere in Scotland, I appeal to you to comply fully with the advice they give you. And that applies generally, but particularly in relation to what they advise you around self-isolation. If they advise you that you're a close contact and you should self-isolate for 14 days, it is absolutely essential that you do that, and that you do that for the entirety of the 14-day period. The further growth of this cluster, which I've reported today, and I unfortunately would expect to be standing here tomorrow reporting a growth beyond the numbers today. This is a reminder of just how easily this virus spreads when it is given the opportunity. And it also underlines, I think, why it was so important that we took strong and decisive action yesterday to try to keep this outbreak under control. Today is, of course, the first full day that these restrictions in Aberdeen have been in place. So let me just take the opportunity to set out again what the restrictions are. However, I would remind you that guidance on all of this is available on the Scottish Government's website. Firstly, we're advising people in Aberdeen not to travel more than 5 miles for leisure or recreation. That doesn't apply if you're travelling for work, education or medical treatment. But one of the particular questions we've been asked since yesterday relates to holidays, so I want to give some advice on that. Our advice to people in Aberdeen is that you should not be going on holiday right now, either to other parts of Scotland or to other parts of the UK. And as those of you who watch these briefings regularly will know, we advise against overseas holidays in general at the moment for people right across Scotland. We're also advising people outside of Aberdeen not to travel to the city for leisure purposes or to visit friends and family. Some people in Aberdeenshire have asked if they can travel into the city for work. The answer is, if it is for work, yes you can, but please follow all of the guidance. But you shouldn't be travelling into Aberdeen, even from Aberdeenshire, for leisure or recreational purposes or to visit family. If you're currently visiting Aberdeen, you can stay, but again, please follow all of the guidance while you are there and take extra care when you return home. Secondly, we're advising that people in Aberdeen should not go into each other's houses. Extended household groups are not included in that, but the restriction applies to everyone else. There are also new restrictions on indoor visits to hospitals in Aberdeen, with only essential visits permitted, and care home visiting remains restricted to outdoor visits only, in line with the current guidance. Finally, we've put in place regulations which require all indoor and outdoor hospitality in the city to close. So all bars, restaurants, cafes and pubs must now be closed. They required to close by 5 p.m. yesterday. Takeaway services in Aberdeen can continue, and hotel restaurants can continue to provide food for residents, but hotel bars must also close. Now, everything I've seen so far suggests that businesses are complying with these regulations, and I don't underestimate how difficult this situation is for them. So I want to thank all businesses who are affected across Aberdeen sincerely for their help and cooperation. In fact, I want to thank everyone in Aberdeen for being so understanding of why this action is necessary, and it is necessary, and for sticking, as I'm absolutely confident you will, to this new guidance. I know how tough this is. I know this is a real blow to the city, and all of us regret that we've had to take this decision. But I do believe people understand why it is necessary. There are just too many uncertainties about this outbreak right now, so we are not yet confident that we can keep it under control without these additional measures. Allowing this virus to run free is, in my view, just not an option. It's not an option at any time, in my view, given how dangerous we know this virus can be, but particularly as we prepare for the reopening of schools from next week. We've therefore taken a precautionary approach. For the moment, unfortunately, that means part of the country has had to go into reverse. But ultimately, we hope that this precautionary action will allow all of Scotland to continue the progress that we've achieved over these past few months. But of course, it's not just people in Aberdeen who have a part to play here. All of us must be on our guard now more than ever. The further we get from lockdown, the more opportunities there are for this virus to spread. As I've said before, when we locked ourselves down, we locked it down too. As we let ourselves out, we let it out as well. That is, I'm afraid, the simple reality of the situation we face. So as we come out of lockdown, we need to be extra careful in absolutely everything that we do. We, all of us, every single one of us, are the first line of defence against this virus. But we will only be as strong as our weakest link. Every time one of us forgets to follow the advice, we risk letting the virus slip through our defence. And as soon as that happens, we're then firefighting, as we see in Aberdeen right now. And Test and Protect is doing a fantastic job in firefighting, but we all have a responsibility to try to make sure that those fires don't start in the first place. So let's all recognise our individual responsibility to the overall well-being of the country. Anytime one of us fails to abide by the health guidance, we give COVID an opportunity to come back. And as we see in Aberdeen, it will take any opportunity it can get. One of the things we know about COVID is that it is infectious. That's why it's so vital to follow these 5 golden rules of the Facts campaign. So let me end by reminding everybody again today. I know you hear me say this so often and probably get fed up with it, but I will say this every day for as long as it takes. And if every day just one more person decides to tighten up, then it will be worth it, because it is really, really, really important that we all take this seriously. So face coverings, you must wear them in shops and in public transport, and you should wear them in any enclosed space. Avoid crowded places, whether they are indoor or outdoors. C, clean your hands regularly and clean any hard surfaces before you touch them or after you have touched them. T, 2 metre distancing, that remains the rule and it remains vitally important. And S, self-isolate and book a test if you have any of the symptoms of COVID. By complying with these rules, all of us individually are doing everything in our power to stop this virus spreading. And we are also giving Test and Protect the best chance to deal with the outbreaks when they do occur, as I'm afraid they inevitably will on some occasions. And of course, we are helping to protect our frontline health and care staff as well. So my thanks to everybody who, in these really difficult circumstances, are continuing to do the right thing. It is hugely appreciated, but it remains enormously important. So my thanks for those who are, and my encouragement, my very strong encouragement, my appeal and plea to everybody who is not, please, please follow all these rules. I'm joined by the Health Secretary and by the Chief Medical Officer, as you can see. We're going to go straight to questions today, though, and therefore I'll take the first question from Andrew Kerr of BBC Scotland.
Thank you, First Minister. Firstly, how concerned are you about a situation like the one in Aberdeen developing elsewhere? So, should pub crawls be banned, and how could that happen? Just secondly, the government's developing a rehab framework to support people with the long-term effects of COVID. When might this be ready, and will people who weren't in hospital or not had a test be able to access support? Thank you.
Okay, on the second question, I'll hand over to the Health Secretary, who will be able to give some more information on that. On the first part of your question, I think it's I hope pretty self-evident to everybody watching that I am very concerned about the ability of this virus to spread very quickly. That's why I still stand here every day, as I say, ad nauseum, as it must feel to everybody watching, repeating the things we all have to do to try to stop that. And we have plenty of evidence now. We've had evidence for the last few weeks in other countries. Yesterday, I note that Spain, France, Greece, I think, recorded the highest number of cases that they've seen in 2 months. We see Melbourne and pretty strict lockdown again. And as I said yesterday, I think we've all been aware of that. I've been very worried about it, but it has seemed far away. We now have it in the northeast of our own country, in the city of Aberdeen. This virus is highly, highly infectious. And so I really worry, because I see the evidence with my own eyes that if it gets the chance, it takes it and it will spread, and it will spread quickly. We know that from our experience back in March, April, and I think we're beginning to see it again from our experience now. But there's no point me just sitting wallowing in worry about these things. I've got a job to make sure that the health service is prepared, to make sure that Test and Protect is supported to do its job, to make sure all the things that government is responsible for are working as well as they possibly can. But one of the biggest parts of my responsibility right now is to persuade all of you watching that government can't do it on its own. This depends on every single one of us. And I am not exaggerating. I'm really not exaggerating when I say that literally every time one of us forgets to wash our hands, comes too close to a person from another household, or touches hard surfaces without them being cleaned, or goes into an enclosed space without wearing a face covering, or maybe just doesn't bother too much when they've got a symptom that they should really be paying attention to, or it goes into a crowded place, even if that is outside, then every time one of us does that, we are taking a big risk that this virus gets the chance to spread. So we all have to take that responsibility really seriously. To go back finally, before I hand over to Jeane on the second question, to go back to government responsibility, we've got to look on a ongoing basis and review this regularly, whether the guidance and the regulations we have in place are strong enough, are fit for the scale of the challenge we face, and are giving the public clear enough advice and information, because I can only ask you to do what you need to do if I'm being clear about that. One of the things we are looking at right now, I gave an indication of this yesterday, and I may have more to say later this week, or at the latest early next week. We are looking at whether we need to tighten up the regulations and the guidance around hospitality. And that could include, I don't want to give specifics of that right now, but it could include taking some things that are currently in guidance and giving them the backing of law, or it could be looking at, from our experience since hospitality opened again, are there particular risk factors that our current guidance maybe doesn't properly cater for. So that is under active consideration right now. And again, without setting hairs running before I properly announced this, I indicated yesterday a concern based, albeit that this investigation is still ongoing, but based on superficially what we can see in Aberdeen, there seems to be potentially an issue of people going from one pub to another. So clearly, we haven't reached a view on that yet, but that's something that we can't simply ignore and not look at, and at least ask ourselves the question, is there more we've got to do to give people the right guidance about what they can safely do, but more importantly, what they cannot safely do right now? And we'll see, as I've indicated, more about that shortly. Jeane.
Thanks very much. The question of rehabilitation for people who have experienced the virus and become unwell because of the virus is really important, and it is, in terms of those longer term consequences, something that we're learning about as we go. What we do know at the moment is that there are long-term impacts to varying degrees for different individuals in terms of respiratory conditions and vascular conditions, and for some in terms of the psychological impact of being ill. So the rehab work that we are developing builds on the existing rehabilitation work that our NHS does in Scotland, but looking to ensure that we increase the capacity so we can cope with more people who might need that. And that is in addition to the rehab work that goes on in our hospital setting, particularly for people who have been in hospital for some time because of the virus, and have been in intensive care, where we know that many individuals need relatively short-term but very important rehabilitation to learn to swallow again, for example, to learn to walk and use their leg muscles. Again, they need to build those up. So there's hospital-based rehab for individuals who've been in hospital because of the virus, but then there is rehab for those who develop longer-term conditions. They may have been in hospital because of the virus, they may not have been, and they will be able to access that either through referral from their hospital team or from their GP. And that is building as part of our remobilisation and recovery work in the NHS. It builds on the existing rehabilitation services that we currently offer.
Thanks. Stephen Brown from SGD.
Good afternoon. First Minister, I wondered if you could update us on the cluster in Aberdeen. How many of those cases are of people living in the city and how many are of those who live out with the city? And also, you'll be aware of those lists of venues associated with this cluster. We've been contacted by a number of posts on social media, quite angry that they weren't told beforehand that they would be on this list and they haven't been contacted by the health board or local authority yet.
On the issue of to use this phrase, the sort of postcode breakdown, I don't have those numbers of the latest case in front of me right now to give you that breakdown. Obviously, there's a lot of work has to go into analysing all these cases. And if there's more information we can provide later, we will do that. One thing I said yesterday, which I want to underline today, we are very, very mindful of the very close integral links between Aberdeen and the Shire, and therefore we are looking carefully at whether there is at any stage a case that can be made for extending any of the restrictions that currently apply to Aberdeen City to areas within Aberdeen Shire. Now, we've not made that decision yet, but obviously people travel from the Shire to the city and vice versa for work and obviously until now for leisure purposes. So we have to be very aware of that, and we are. That's part of the ongoing investigation that is underway. On the point about premises not being identified, I would ask, we try, and I'm sure that the Health Board and the local council are, well, I'm not sure, I know they are all working incredibly hard and try to contact any premise, do contact premises where there's a need to do it as part of contact tracing, and would try to contact premises before any information comes out into the public domain. But there's always a balance we need to strike because, you know, as people will recall, you know, the Scottish Government over the course of this pandemic have been criticised about not putting information about the potential sources of outbreaks into the public domain, and then when we do that, we can face criticism for doing it before people have had the chance to know. We have to make judgments in these situations. Those dealing with these outbreaks on the front line have to make those judgments, and I back them to do that. And I would ask people to be understanding of the complex and fast-moving nature of the situations that the local public health teams are dealing with when they face an outbreak like this. It's also, and this is not a complaint, it's just a reflection of reality, it is complicated these days by social media. So if a local outbreak team decides that there's no need to name a premise from a public health perspective, that doesn't mean that that premise is not named either by itself through social media or by others. So there's also a need to balance all of that, and we will try to act with transparency and protection of public health absolutely at the heart of what we do. Alan Smith from Bauer.
Thank you, First Minister. Just to follow on from Stephen's question there about premises who say they haven't been contacted before this cluster list was issued, and they said the first time they were aware that their business was potentially affected was when customers contacted them after seeing this list. How can Test and Protect work if there is no official contact with these businesses and there are no official contact in this business for customer details?
I think we need, well, on customer details, it is really important that premises like pubs, restaurants, cafes collect details, and I earlier on talked about the consideration we're giving to putting certain things that are in guidance now into regulation, and that may be one of them that we think about, because I hear anecdotal reports that some businesses are doing that assiduously, but others are a bit more laissez-faire to the point of not bothering. And, you know, I understand, you know, what a pain in the neck it is for businesses to have to do this, but it is vitally important, and I cannot stress that enough. In terms of and this is not a complaint, it's just a reflection of reality. We have to, and I appreciate that Test and Protect is new for most people. So everybody's getting used to understanding how it works. And that also means people trying to understand why they might not be contacted by Test and Protect when they might think they should be, as well as understanding why they are being contacted. Test and Protect, is led in this part of what it does by experienced contact tracers, and they make judgments based on the information they have given to them by positive cases about whether somebody actually needs to be contacted based on how close they've been and what the risk factors are. And we need to trust them to do that. And I think as we go through this, obviously if in any situation that doesn't work as well as it should, we have to learn from that and make sure it does in future, but we have to trust that judgment and we have to develop trust in that judgment. So it will not always be the case that Test and Protect is contacting somebody that a member of the public might think it should be contacted. And therefore, just as we'll see information on social media that the experts might not think, strictly speaking, has to be in the public domain, so we will find people being contacted by members of the public saying, you're a contact, you should be getting contacted. But it's perhaps the judgment of Test and Protect that is not necessary. We're all going to get far more used to how this system works, unfortunately, over the next period, and I appreciate that will mean us having to explain and set out some of the things it does and doesn't do as we all get much more familiar with it. But the most important thing is when Test and Protect does contact you, make sure you abide by the advice that they are giving you. Do you want to add anything on how contact tracing works?
Contact tracing is not a new phenomenon. It's something that health protection teams have been using for decades and decades, and the first priority for them is to speak to the individuals concerned so that they can get a sense of who they are, where they've been and what contact they might have had with other people. And using that information, they can then assess the relative risk that there might be to others. And then that triggers, of course, other actions such as contacting particular premises, particularly if there's been contact with people who are not known to the individuals at the centre of all of this. So there's a very well-worn pathway that these teams take in terms of collating that information and making sure that they've got the right information at the point in time where they make that contact with, whether it be an individual, whether it be a business, so that they can give them the proper advice that they need and that as part of that discussion.
Can I just, a quick follow-up then? You're talking about tracing individuals, but how can you trace those individuals if these businesses aren't being contacted for the individual details?
At the centre of that case, and if that index says, but I was in contact with someone that was less than 2 metres distance, I don't know their name, I just know it was in this place, then that might trigger a contact with a particular business to try to get further information as to who would be in that place. As I say, it's a very well-worn pathway that these teams take in that, where an individual is able to say, well, listen, I was in a place and I was sitting with 4 friends and their names are blah, 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 blah. Then that can initiate contact directly with those people. And it may be that they don't need to contact a particular place with the haste that is needed because they've already got a sense of exactly who has been risk assessed and needs further follow-up.
Or if somebody, and I'm not talking about the Aberdeen situation here, I'm talking entirely hypothetically. If somebody says, I was in this particular place, but I was in for 30 seconds dropping something off, I had a mask on at the time, the Test and Protect team might think that the risk of that is so low that it is not their immediate priority to contact that premise. They'll contact the people that the person had closer contact with. So the point I'm making here is there will be different circumstances. This is I don't have any experience of doing it. I just know from what I learn and from those who do it. It's a very complex process, but it is led by people who do know what they are doing. That said, we will of course learn from every outbreak that we face to try to see whether the lessons of it say that anything in the approach should be modified for the future. But we should have, obviously, as we go through this, Test and Protect will publish more information about the numbers that they are contacting. But we've got, on the information I have right now, they are contacting successfully a very, very high proportion of the tracing a very high proportion of the contacts, and that should also give us a degree of assurance about how the system is working. Phil McDonald from Global.
Thanks, First Minister. Is the local lockdown in Aberdeen expected to affect schools reopening next week, given that you may have children travelling into the city for their lessons and then returning to their homes in Aberdeenshire? And is there going to be any specific advice for schools in Aberdeen, for example, masks in classrooms?
I can't remember, Phil, if you were on the call yesterday, but I was very clear yesterday. Part of the reason for this very precautionary approach in Aberdeen is to protect the ability to get children back to school. Aberdeen schools will start to return for orientation at the middle of next week. I think from Wednesday next week, it will be a week on Monday before children are back in school full time. But this is about making sure we're taking action elsewhere to protect that, because if we have an outbreak that just runs completely out of control, then that compromises the ability to get children back to school. So this is about trying to avoid that so that children can go back to school, because we have very clearly said that is our priority. And on the travel point, again, as I've said very clearly today, the 5-mile travel advice is for leisure or recreation. It does not apply to people travelling to work or for healthcare or for education, but it does apply to people who are just going to shop or they can't go to the pub in Aberdeen just now, or to visit family. So for leisure or recreation, that 5-mile advice is very clear and very strong. Fraser Nicholl from Original 106.
Thank you, First Minister. Good afternoon. Extra police officers are being sent to Aberdeen to help enforce these restrictions in the city. There is a lot of anger, though. A lot of people are asking why they went there to prevent the large crowds outside pubs at the weekend. And businesses in Aberdeenshire have told us they are going to be enforcing these rules themselves, asking customers where they're from and turning people away if they're from Aberdeen. Can you give any indication if the police have told you at all why they didn't play a bigger role in the situation? And with extra officers being sent to Aberdeen City, could you tell us if extra will be sent to Aberdeenshire as well to help deal with the situation there?
On the first part of the question, look, I'm not going to stand here and comment on the operational decisions of the police. What I will say, and I apply this to myself as much as I apply it to anybody else, we're in a really difficult situation that is not of any of our making. This is a virus that we've been hit with, and we need to all adapt our behaviour to try to beat it. So let's start with all taking responsibility for our own behaviour. Of course, the police have got an important role to play, but every time the police have to step in to manage a crowd of people, then it's a bit like what I said before about the first line of defence and the second line of defences. The crowd of people is only there because a bunch of folk have not behaved themselves the way they should behave. They've breached the clear guidance by avoiding crowded places. So we are the first line of defence. And if that first line of defence breaks down, then Test and Protect have to come in and firefight, the police have to come in and firefight. Actually, it's much better if we keep that first line strong. And that means all of us doing the right thing. So let's not have crowds that the police have to manage, because we're all avoiding crowded places, which is the second letter of the facts advice. I don't want to sound as if I'm standing here every day, because I know I am sounding like this, as if I'm just giving people lectures, but please understand how important this is, and let's not start, well, the police should have come and broken up the crowd. The crowd shouldn't be there in the first place if we are following the advice, and that applies to all of us. I'm not separate from this. I'm a citizen of this country as well. We all have to obey these rules because they are there for our own protection. And on the deployment of officers to Aberdeen, these are operational matters for the Chief Constable. The Chief Constable has a flexible force that he can deploy to deal with particular situations. The police yesterday, DCC Care was part of the SCORE decision yesterday and made the point, as the police have made publicly all along, they will only step in to enforce as a last resort. They see rightly their first role as being to give people advice and encouragement to do the right thing voluntarily, and enforcement is only there as an absolute backstop if absolutely necessary. And I saw the comments that DCC Care made this morning, paying tribute to people and businesses in Aberdeen for complying. The police are there for extra assurance, but people, I think, in Aberdeen, by and large, will do the right thing voluntarily, and for that, you all have my deep appreciation. Neil Pooran from PA.
Thanks, First Minister. If I can ask about the increase in cases in the Greater Glasgow area, I appreciate you're still looking to see what kind of link is there, if there is one. Are we able to say any more about the demographics of who's involved in these cases? I know in the past we've seen an uptick in cases in younger people who might be going out into pubs and clubs. Is that continuing?
I can't give a breakdown right now on the Glasgow cases. Suffice to say, we are looking very carefully at that, and I hope that I will later today have more information. Yesterday's cases we looked at, there didn't appear to be any particular patterns. There were a couple of family clusters, and I think 3 cases of them were associated with different care homes. So there didn't appear to be anything pointing at that stage to a particular outbreak. But obviously we'll be looking at today's cases and continuing to give ourselves, hopefully give ourselves assurance, but also if there does appear to be anything more worrying, then be able to consider what needs to be done. On the demographic breakdown, I don't have that for Greater Glasgow and Clyde cases today at the moment, but generally speaking, right now, we are seeing, and this is different to an earlier stage in the pandemic, where this wasn't the case, but we are now seeing an increasing proportion of positive cases being in a relatively younger age group. And by that, broadly speaking, what I'm talking about are the under 40s, 20 to 40. I've had a couple of people on social media after me making this point over the past week saying, oh, you sound as if you're blaming young people. And I want to be really clear, I'm not blaming anybody for this. It's not anybody's fault that we're dealing with this virus, but I wouldn't be doing my job properly if I didn't point out the trends that we are now being able to identify through all of this data, because that then allows me to say, if it is the case, and it would be perfectly understandable, so I'm not judging you for it, it's perfectly understandable in the younger age group, since pubs have opened after 4 months of not being able to do this, you want to socialise a bit more and you want to see friends a bit more. That is absolutely understandable. But what the data is telling us is that is maybe becoming one of our biggest risk areas, and therefore it's incumbent on me and Gregor and Jeane to say to people, look, remember you've got to follow all of this advice when you're doing this, because you're not immune from this. So I just generally want people to know I'm not standing here pointing the finger and blaming people, but I just know how important it is for all of us to follow this advice, or we will end up back in a situation that none of us want to be in. Christine Lavelle from The Sun.
Thank you, First Minister. It was just on the Aberdeen cluster as well. Will any extra financial support be made available for hospitality businesses and the wider economy in Aberdeen, which have obviously had to close less than a month after they were permitted to reopen?
I covered this point briefly yesterday. So I'd say 3 things briefly, and obviously we'll say more about this possibly in future. Firstly, just to reiterate the point that businesses can still, if they have brought staff out of furlough, they can refurlough those staff, and that is an option available to businesses in Aberdeen right now. Now, one of the concerns we have, of course, is that once the furlough scheme ends, that will not be possible. I briefed the other 3 nations of the UK on a call yesterday about the steps we've taken in Aberdeen. It's an indication of how closely we are sharing experiences on this, but obviously that was one of the points that I think all of us are mindful of right now, is about the continuation of that support should there be these local situations in future. Second point is, as I said yesterday, we will discuss with Aberdeen City Council what further support they can give and what further support the Scottish Government might be able to give. And thirdly, the Scottish Government, of course, is looking at what further support we might be able to provide over the longer term to individual parts of the country that might face localised issues. And we haven't come to a conclusion on that yet, but if you think in terms of, when individual council areas are hit by flooding right now, they can apply to the Scottish Government for additional support. So it's that kind of thing we are considering, and obviously when we reach decisions on that, we will set them out as usual. Paul Hutchin from The Record.
Hi, First Minister. You'll be aware of the anger felt by pupils who've had their grades lowered as a result of the SQA's system of moderation. Now, given this mounting anger, will you instruct the SQA to cancel all grades that have been lowered as a result of this system and instead replace them with grades that are based on teacher judgment?
No, I won't. I won't do that because I don't think that would be the right thing to do either. That said, and I've addressed this in the last couple of days here, I totally understand and sympathise and empathise with any young person who is in the position of having a grade awarded by the SQA that is lower than the teacher estimate for that grade. So I absolutely understand, to use your word, the anger and upset that young people will be experiencing. We're in a situation this year where we couldn't have exams to determine the award, so the SQA had to put in a system that allowed there to be a set of results with confidence that overall they were reliable results. But we equally have always recognised that there had to be a next part of this process, which goes from effectively statistical moderation to individual moderation. So every young person who might be watching or their families might be watching who is feeling that understandable grievance right now that their award is lower than the teacher estimate submitted for them can now go through the appeal process where their individual circumstances are looked at. Their teacher and school or college, as the case may be, can put forward evidence, whether that's based on a prelim result or any other evidence that the teacher thinks is appropriate and relevant. And then that is looked at on an individual basis. And therefore, if there have been, as I am sure there will have been, circumstances where the grievance that a young person feels is legitimate, then that will be rectified through the appeal process. Now, I know this is not an easy situation for young people. There is a priority being given in the appeal process for in terms of, not overall, but in terms of the sequence in which this is being done for those who are currently waiting for university or college places. And they are being asked to get their appeals in by, I think, the 14th of August. I think for everybody else, it's the 21st of August. And that process will be completed as quickly as possible. So I do understand, and I want every young person to feel they've been treated fairly. And I also want the qualifications that young people have from this year's process, not just to feel fair to the individual young people, but to overall command the confidence of colleges and universities and employers. And we've got to go through the next bit of this process to make sure that happens. Alistair Grant from the Herald.
Hi, First Minister. Thanks very much. Just to go back to the Aberdeen cluster, and apologies if this was mentioned before and I maybe just missed it, but what is the age breakdown for the 79 cases in Aberdeen? Is that still predominantly young people, as you suggested the Glasgow case might be? And just as well, can I ask, do we know who the index case is in Aberdeen, how this cluster started? Do we know anything about who it was or where it came from? And just finally, I think you suggested when you were talking about your active consideration of kind of tighter rules for hospitality venues, that there could be some kind of crackdown on pub crawls. How would you see that being policed or enforced?
So on the question about index case, that is all still under investigation. There will be some outbreaks where maybe Gregor wants to say a bit about this. There will be some outbreaks where it is never possible to definitively decide or determine what the index case has been, but obviously these are all things that the incident management teams look at. In terms of the age breakdown, obviously the situation in Aberdeen with the number of cases is changing all the time at the moment, but overall the information I have is that the age breakdown is broadly in line with the kind of age breakdown I've been given for cases across Scotland in the last 7 days, maybe not exactly, but the point I've been making that there is an increasing proportion of younger people, I think is borne out by the information we have on the figures from Aberdeen. And on the pub crawl point, look, I would caution everybody, I try to talk as openly and as fully at these briefings as I can, but when we have actual decisions to announce, we will announce them. So don't take from my thinking out loud about some things that it will automatically lead to a particular decision. And that's true of pub crawls as it is on anything else. But the point to make in response to your question, which is a really valid one of the considerations we have to make about deciding whether any restriction is reasonable or not is, can it be enforced? Is it something that is possible to enforce or not? And then we have to make a judgment, well, even if it can't be enforced, is it still worth doing because it encourages people, or does it mean that it's not worth doing at all? So that is part of the careful consideration we give to all of these things before coming to a final conclusion. Gregor.
So from the sequence of events, clearly we know who were the people who tested positive at the early stages of this outbreak, but that doesn't necessarily mean that those were the only people that were implicated in the early spread of it. And of those individuals who did test positive in the early stages, we don't know who introduced the infection to whom at that point in time. And as the First Minister has already said, we may never know that. That's often the case, particularly in complex outbreaks like this. But we do know, as I say, some of the patterns of spread that may have arisen from those individual cases and how those start to form clusters of people associated with each one of those individual cases. Can I say just a little bit about the age range as well, because I think it's important. Although we are seeing a very strong signal for younger age groups testing positive with this, I think the other thing that's important to say at this point in time is it's not solely younger age groups, and that the age ranges we're seeing both in this outbreak and around the country still involve older people as well. And of course, we know from the experience that we've had over the last few months that those older people are more at risk. So I don't want people to go away with the thought in their mind that although we're seeing more younger people testing positive here, that this is solely happening and being driven by a younger population. It's clearly just a signal and a changing demographic that we're starting to see more strongly.
Thanks. Scott McNabb from Scotsman.
Thank you, First Minister. On the row over grades being awarded to pupils this year, when you talk about encouraging them to go down the appeals route, can I just be clear, will this appeals process still continue to take into account the background of the schools involved? Because that's what seems to be the focus of much of the anger here. And also on when you talk about the prevalence of COVID among younger people, increasing prevalence among younger people, and saying that's one of the biggest risk areas, is there a need perhaps for targeted action, whether it's advertising campaigns, social media pushes, something like that, to really get the message home with the younger generation?
Yes, we are. Health Secretary might want to say a word or two about that. On the first question, which is an important one, let me be clear, and the SQA website I know has guidance for schools and colleges on how to support an appeal, and it confirms that appeals will be based solely on a candidate's individual merit based on the evidence that's presented by the school or college. And schools and colleges are being encouraged to submit a wide range of alternative evidence, so not simply a prelim result or a class test, although that is important evidence, but anything they think is relevant to the individual's own assessment and performance. So, but that's the important point. Appeals will be based on the candidate's individual merit, and that is the individual part of this process. The first part, yes, has had a statistical modelling methodology attached to it, moderation attached to it. But this next part of the process is very much about making sure that any individual cases of genuine unfairness can be rectified. And that's why I would encourage all young people who feel that they've not had fair results to go through this appeals process and to talk to their school and college about it as quickly as possible. Jeane.
On the communication point, it's a very important point. And as you'll have seen, as we have gone through our response to COVID-19 from the early days through to where we are now, we move the response that we make. And we're now in a much more targeted response phase as we continue to want to keep the virus as low as possible, and we take targeted action. And that also applies to our communication. And so we're now actively looking at the moment at exactly how do we communicate between different age groups across Scotland? The messages are the same because they're the messages that help each of us individually do our part to keep the virus as controlled as possible and not transmit it. But there are different ways of communicating that message to different groups of people, different channels that we might use, but also different individuals to communicate that message. It's a very long time since I was one of those young people. And I know that me, for example, communicating some of those messages, I won't be hitting the right spot. But there are other people who can do that and do it better. So that's the work that's underway so that we target our communications. It's the same message. It's all about keeping the virus suppressed, but do it in a way that people hear it in different age groups across the country.
It is a gay long time since the Health Secretary was one of those younger people, even longer ago than I can claim. Seth Carell from The Guardian.
Good morning. Sorry, good afternoon, First Minister. Can I ask you, please, a question about the return of schools next week? There's new evidence emerging from the CDC in the United States and Israel and other countries, and also expert evidence from Professor Neil Ferguson that children, and specifically older teenagers, are carrying and transmitting the virus, and that older teenagers do so with the same frequency as adults. So given that, are you prepared to reverse or halt the full reopening of Scottish schools if evidence shows that the 100% reopening of them so soon was a mistake?
Seb, I think if I was to stand here as First Minister and say to you, regardless of any evidence that materialises over this virus, I will not change my approach to any aspect of it, you would rightly think that was a deeply irresponsible thing to say. We will always be evidence-based in the decisions we've taken as far as possible and apply our best judgment to the evidence that is there. So that's a general point, let me say, not specifically in relation to schools. On the evidence, and if there's particular items of evidence there that you want us to give a more specific response to, I'm happy to do that later. But yeah, as I say, I can't remember if you were on the call, I think last week when the Deputy First Minister was here, and the example of the Israeli evidence was specifically raised, and John made the point then that our advisory group that advises us on these things from a scientific point of view had looked at that and taken account of the international evidence and putting the recommendations to us. So the advice we have got has given us the foundation on which to make the policy decision that we should be getting schools back full time. And of course that is also driven by the understanding of the toll it is taking on young people not to be in full-time education. But whether it's on schools, whether it's in hospitality or any other aspect of this, of course we will continue to be driven by emerging evidence, because as people again have heard me say countless times, this is a virus that we still don't fully understand. We understand much more about it now than we did in February, March, but we're still learning about it. So any responsible government, and I certainly like to think that is the Scottish Government, will pay very close attention to emerging evidence on every aspect of this. But I would not be, and I think it's important for me to make this point clearly to parents, who might be watching this as well as to young people themselves, we would not be advising the return of schools from next week if we didn't believe that was a safe thing to do with all of the mitigating measures that we are asking schools to put in place. I'll ask Gregor if he wants to say a bit more about evidence that is emerging, whether on schools or more generally.
So, Seb, I think I know the evidence that you're speaking about when you refer to these trials, and what we should do is just make sure that we've double-checked with you that we're talking about the same trials, because if they are, then they have been actively considered by the subgroup of the scientific advisory group that's specifically advising on the educational recovery plan. And they've looked at it, they've assessed the quality of the evidence that's within those and factored it against other pieces of evidence as well. And I know that even this week they continue to review and consider further pieces of evidence. So it's not something that's a static process at all. It's something which is kept under active review so that at all times the latest evidence which is available, that group is considering and making sure that we keep up to date with that. But perhaps if you can give us the details of the specific pieces you've given us, we can just cross-check that and just make sure that it's the same pieces that we're referring to.
Okay, thanks. Adele Merson from the P&J.
Thank you, First Minister. We have been told there are only approximately 8 contact tracers working in the NHS Grampian region of almost 600 across Scotland, and that the team in the North East is struggling to reach everyone they need to for contact tracing purposes. Are you able to confirm if the Health Board will be given any additional resources to cope with the number of calls which must be made in days ahead? And could you also confirm how many contact tracers were committed to NHS Grampian when the outbreak first came to light last week?
I don't have the number of how many contact tracers are currently working on this. I can get you that information. What we obviously are in close dialogue with NHS Grampian. We will continue to support them through advice and additional resource that they need. This work is of absolute paramount importance, and therefore they will have the support that they need. What I do know from the information I have is that they are doing a very good and very effective job in terms of the contacts that are being identified and traced. It's from the figures I gave you earlier on, it's more than 200 now, and that will continue to increase as the number of positive cases, unfortunately, is continuing to increase. But we will have an ongoing dialogue, in this case with NHS Grampian, but with any health board or local authority that might be facing similar outbreaks in future. Dan Sanderson from the Telegraph.
Thank you very much. First Minister, at your old school, Greenwood Academy, just 23% of pupils got 5 or more hires last year, which, as you'll know, is well below the national average. You've spoken a few times over the past couple of days about how you remember well how you felt on results day. So can I ask, how do you think you would have felt if your results had been downgraded, not because of how hard you worked or how clever you were, but because of the historic performance of the school? And also, if that had happened to you, might a young Nicola Sturgeon have been among the teenagers who were planning on protesting outside the SQA offices on Friday?
Very possibly. Look, none of this takes away from the fact I absolutely understand the way young people who feel they've been unfairly treated will feel. Every single year when you have results day, you'll have young people who are disappointed. But usually they'll have sat an exam, so they'll have probably a sense themselves of whether they didn't perform as well as they had expected, although you'll still get some, no doubt, who feel that it was unfair. That's compounded this year because young people haven't got that objective exam to sort of benchmark against. And if you're a young person whose teacher has estimated 1 grade and you've got a lower grade, you're going to feel very aggrieved about that. And I absolutely understand that. And if I had been in that position, I would feel aggrieved about that. And my old school, it's not just my old school, it's the current school of my own niece. And although she didn't sit exams, she's not quite at that stage yet. So, you know, I know how really horrible this will be for young people that are in this position. And if I was standing here and saying, well, tough, that's it, you know, just accept it, then that anger would quite rightly be even greater. But I'm not saying that. There is another part of this process. And if you're a young person in this position, you will feel, I wish I didn't have to go through this next part of the process. But there is a next part of the process where if you're a young person in this position watching right now, I'm talking directly to you, you can appeal this and have your individual circumstances looked at. So if you're sitting there right now and you're thinking, for example, I got 90% in my prelim for this subject, but I've only been given a B, that will be looked at, not in some statistical way, but on your individual merit. And if you have been treated unfairly, that will be rectified through this process. Now, again, I wish you didn't have to go through that, but I come back to the point that is just inescapable. We've faced a situation this year where, because of the pandemic, everything's been turned upside down. So we've had to put in place a different system of assessing young people's performance. And while I absolutely understand the concerns about the system that has been used, I think whatever system had been used to do this, to substitute for exams, would have led some people to think it wasn't fair. And that is just inevitable in a situation like this. But that's why this year in particular, this appeals process is so important. And so I would say to every young person in this position, I feel what you're going through, but we're not saying this is the end the road for you. If that's what we were saying, that would be wrong. But this next part of the process is about how we make sure that genuine individual injustices here can be rectified. So please, if you haven't already, talk to your school or college if you're in this position so that they can submit the appeal with any evidence that they think is relevant, or you in discussion with them think is relevant, so that your individual merit is properly considered. Mark McLaughlin from The Times.
Thank you, First Minister. One for the Chief Medical Officer. Is there any indication that the cases in Aberdeen came in through Aberdeen Port, or maybe from England, the north of England, perhaps through oil workers reporting for duty? And one for you, First Minister, on the SQA results. The methodology shows that if moderators could not find any evidence to support a teacher's grade, that teacher's grade was accepted at face value. If they did have evidence, that grade would have been moderated. So does that mean that if you had a diligent teacher who kept good records, you were more likely to be moderated? And if your teacher was less diligent, then your grade was more likely to be taken at face value? And what does that say about the credibility of the methodology?
I'll hand over to Gregor on the point for him. I'm not sure I would agree with that, but I'm happy to reflect more on the detail point you're making and come back to you later on that. But I don't think that is a conclusion I would draw. I'm not going to repeat everything I've just said, but I just would repeat one thing, that Tuesday was not the end of this process. This is a multi-stage process, and the last part of the process has still to be gone through. And I'd also make the point that, and I know before I make this, if you're sitting here as a young person or the parent of a young person who feels aggrieved by this, I know this is no comfort to you, so I'm not saying it with that intention. But the overall pass rate is up this year, and there have been, there have been some people saying, "Oh, that in itself shows that there was too much leniency on the part of the SQA." I don't agree with that, but the pass rate is up for hires, for National Fives. It is up for young people from our most deprived communities. So let's not lose sight of that, while we absolutely seek to address the individual concerns that any individual candidate has. And this next part of the process is really important, and I would ask people to remember that. And then at the end of that process, we'll see the overall percentages in terms of what the pass rate for individual exams has been. Gregor.
Thanks for your question, Mark. So in answer to your direct question, I'm not aware that there's any particular link through the Aberdeen port in terms of any of the people who have been identified. But as I said, I just don't have that degree of information. I am aware, however, that clearly the possibility of introduction from foreign travel is something that all Test and Protect teams are asking about, and over the course of the questioning of the people who've tested positive so far, they've certainly revealed that some people associated with this outbreak have had some aspect of foreign travel in the recent past. Now, the significance of that is yet to be determined. Just because you've had foreign travel doesn't mean to say that necessarily that's where you've contracted the infection. I think we'll only know the sources of each of these cases infection in the fullness of time once something like whole genomic sampling has been done of the virus which is associated with this outbreak, and that will reveal whether there's any unusual patterns of particular virus family that we're starting to see associated with this outbreak.
Thanks. And lastly, Michael Blackley from the Daily Mail.
Thank you, First Minister. Given that you're encouraging people to appeal, we have a situation where there might potentially be up to 124,000 appeals coming in. Is there any extra resource being put into ensuring that these are dealt with quickly? And also, regarding next year, I appreciate that you expect and hope that exams will go ahead as normal next year, but there's a chance that they might not. Will this moderation system still be the standby approach next year if exams don't go ahead?
Well, that will be considered in the fullness of time, and I'm not going to get ahead of that. On the very legitimate point about the possibly, in fact, not possibly, I think inevitably increased volume of appeals this year because of the circumstances we've been in. The SQA have already ensured that they have sufficient resources in place to support the appeals process and the estimated increase in the number of appeals. I think I gave some of these dates earlier on, but the deadline for submitting appeals for candidates looking to confirm a college or university place is the 14th of August. 21st of August is the deadline for all other appeals, and results will be sent to the school or college by the 4th of September. So this is will absolutely be a bigger exercise than normal years, and this part of the process is more important than normal years. The SQA are resourced to do that, and the timescale for that is a tight one that the SQA will be working to deliver on. That concludes the questions today. Thanks to all of the journalists, to Jeane and Gregor and Rachel, our BSL interpreter, and thanks to all of you for joining us today. Can I just end with the usual advice, but I think you can probably hear the plea in my voice as I say this every time. Please abide by facts. The face coverings, avoid crowded places, clean your hands, hard surfaces, 2 metres distance, and self-isolate and book a test if you have symptoms. COVID is on the rise again globally across Europe, and I think we have some evidence that it may be on the rise again here in Scotland as well, not just around the outbreaks, but maybe a bit more generally. So that means we've all got to absolutely tighten up our defences against it and make sure that we're not giving it the opportunities that it will so readily take. So my thanks to everybody who's doing that, and my encouragement to everybody who might not have been, please tighten up on all of it. I'll be back here tomorrow for the last update of the week at 12:15. I will see you then. In the meantime, thanks for joining us.